All right, first question here. This is a question focused on learning how the brain works. So for those who are attending today, who are interested more in learning about their own brain and how it functions, how can Mindshift help individuals gain that deeper understanding of their brain's role, specifically around addiction recovery? And I know we talked about this, Dr. Jud, earlier. So any final thoughts? I know there are some on the call too who may be further along in their recovery journey. How can those people use Mindshift as well? So curious to hear your take on that.
That's a great question. So how can somebody use the Mindshift mindset to understand how their brain works and learn to work with their brain in their recovery journey? The key here, I would say, is that we can foster this asset that we all have of awareness. So when we can start to become aware of the habit loops that we're stuck in, when we can start to become aware of the consequences of the behaviors that we've been stuck in, and when we can also start to learn the value and the power of awareness itself in helping us change these behaviors, this is really tapping into the deepest, the oldest, the strongest parts of our brain, which learn through this reinforcement learning process. You know, the irony is that whatever our addiction is, we've learned that through reinforcement learning. You know, there was something rewarding about it at first. There's something that keeps it going. And the awareness can help us be able to recalibrate how rewarding that is for us right now. Is it still rewarding? You know, for example, somebody, most of the folks in my clinic and in my previous studies who have tried to quit smoking typically start smoking around the age of 12, 13, 14, something pretty young. And this is often related to social pressure, wanting to be cool at school, rebelling against their parents or society, whatever. There's something there that drives them to smoke. It's not the cigarettes, because nicotine as a toxin, the first time somebody ingests nicotine, and for anybody that can remember back to the first time they used a nicotine product, it tends to make people feel pretty nauseated. Why is that? Because our body is saying, hey, you are ingesting toxin. Are you sure you want to do this? So once we become tolerant to whatever the substance is, our bodies then ironically, say, hey, I need more of this, because we are now in that addiction spectrum. So here we can bring that awareness in and see and ask ourselves, is this really rewarding for me now? I remember somebody who came to me who'd been smoking for about 40 years. And we calculated the number of times he had reinforced his habit loop, and it was roughly 300,000 times, right? So he was not paying attention to what a cigarette tastes like right now for him. He would go out and smoke, look at his phone, talk to his smoking buddies, whatever. And so we had him just start paying attention as he smoked cigarettes. And he came back and he said, how did I not notice this? As in, these really taste like crap. He'd been going for 40 years and had not, really been paying attention to what smoking tasted like, what it smelled like, how that smoke felt in his lungs right then. And that was really a turning point for him to start to see, wow, this is really not very rewarding. And that's a great example of how we can actually use this Mindshift mindset to leverage that strength of our brains to be able to start to step out of these old habits.
Okay, question number 2. So this question is specifically around Mindshift's approach. So Mindshift Recovery has integrated brain science and mindfulness into addiction recovery. How does this approach work hand in hand with other methods, and what specific benefits can individuals struggling with addiction expect from practicing mindfulness? So interesting. We touched upon this briefly, but again, curious to hear your take on it.
That's a great question. So how can somebody integrate this core asset of awareness, or we think of this package as mindfulness training? How can they integrate this with other methodologies or other communities that might be supporting them in their recovery journey? Well, the nice thing about science is that and I say this, the nice thing about science, because this is really a neuroscientifically based approach, is that it fits with any other methodology out there. So as an addiction psychiatrist, I've studied a lot. I've worked with a lot of patients who have been in different recovery communities, and awareness is really lines up pretty nicely with all of these. So whether it's AA, whether it's smart recovery, whether it's refuge recovery, whether it's another, cognitively based approach, awareness can help support all of these. It's not antithetical to any of these, and it also fits with any religious background. Helping somebody become aware can help support them not only in developing this mind shift mindset, but also helping them strengthen their recovery and support them in these other communities or methods that they might already be very familiar with or using for a long time.
All right, question number 3. This is about brain function and mindfulness. So Dr. Brewer, you've extensively researched the relationship between mindfulness and the brain. Could you share some findings, if possible, and highlight how mindfulness practices can positively impact the brain and aid in addiction recovery? I know there are some here that are eager to learn if possible. So curious.
I would say so that, how does this mind shift mindset affect the brain? I would say the biggest finding that my lab has had and it's actually been over the last decade now, started with us being very curious about what the brains of expert meditators look like. And so we brought a bunch of expert meditators into our scanner. I was at Yale at the time, and we just wanted to see, what happened when people were meditating. We were very curious about that. This was in conjunction with, I was doing clinical studies with addiction treatment at the time, where we were, using mindfulness training as the core training methodology. So we wanted to see, okay, if somebody's been training for a little while, what might their brain look like? And that's when we discovered that this default mode network, this network of brain regions that gets activated when somebody is, is getting caught up in a craving, let's say, whether it's cigarettes, whether it's cocaine, whether it's alcohol or even chocolate, what happens? And what we found was that expert meditators were pretty good at quieting down that network of brain activity. And we went on to look to see, what exactly is going on there. So we did some neurophenomenologic studies to actually line up people's subjective experience with their brain activity. And what we zoomed in on was, it seems that it really is this experience of getting caught up. So when we get caught up in worrying, when we get caught up in a craving, when we get caught up in self-judgment, all of these seem to activate a specific, hub of the default mode network called the posterior cingulate cortex. And that is what we found with expert meditators was deactivated when they were meditating. So we might think, okay, great, I need to become an expert meditator for this to work. No, that's not true. So we, in our study looking at people who wanted to quit smoking, we found that even with using our Craving to Quit app, they could learn to use this mind shift mindset and start to deactivate this default mode network. And the more they were able to deactivate this network, the more this correlated with a reduction in cigarette use. And that was after only a month of using an app. So what this suggests is that anybody can learn this. Anybody can draw upon the power of their awareness and start to bring that awareness in and get curious about their experience, start to learn to ride out these cravings using awareness, using curiosity. And they don't have to be some expert, monk or nun to tap into the power of their brain.
Okay. Question number 4, just keeping track of time. Let's see. Okay, this is another neuroscience question. So question about the neuroscience of addiction. Dr. Brewer, could you please provide an overview of the neuroscience behind addiction, which maybe this is a correlation to what we just talked about. Some key insights from your research to help us better understand how addiction affects the brain. So we talked about this, but anything lingering or any additional outliers there?
I think the one thing I would say is that we certainly don't know everything when it comes to the neuroscience of addiction. So we've been zooming in on what are consistent findings, and more importantly, what are pragmatic findings? Because there can be, you can discover some brain region that's involved in addiction, and then we can ask, so what, right? How does that help, one of my patients? How does that help somebody that's struggling with an addiction? Just knowing that there's a brain region that's a little out of whack, so to speak. It might not be that helpful. So this is where we wanted to really zoom in and find, what are the pragmatic take homes? What are the pragmatic lessons that we can learn from this neuroscience? And what we've found is that, this network, this default mode network, which seems to be, correlated with a number of addiction, different types of addictions. Really, it's getting caught up in experience, which is probably common to all of us. We can specifically target that network of brain regions, and we can develop tools that really zoom in there to help us, really target those networks.
Very interesting. Thank you. Thank you for sharing that. I feel like we can have multiple topics on this, multiple sessions on this topic rather. Okay, the last question we have listed here, practical tips. So what practical tips or exercises do you recommend for our audience who may want to incorporate brain science and mindfulness more so in their daily lives to support their addiction recovery journey, and also gain further insights into their brain's functioning?
Great question. So what are some practical tips that anybody can use? So here, I think it goes back to the concept of curiosity as a superpower. And so if we think of getting caught up in an addictive habit loop, most of these have one thing in common, which is there's a craving for something, and that craving can get triggered by an unpleasant emotion or just by withdrawal or any number of things. So we can learn to bring curiosity in when we have a craving. And craving tends to have some flavor of a mental attitude that's like, oh no, I need to make this go away, or oh no, I need to scratch this craving itch right now, or because it's really uncomfortable. So the practical tip that I would give anybody is we can start to bring in curiosity as the superpower. When we feel that, oh no, come on, we can go, oh, here's a craving. And by, oh, we start to notice what curiosity feels like. We can go, oh, what does this craving feel like? Where do I feel it in my body? Is it on the right side? Is it on the left side? Is it in the front? Is it in the back? What are the characteristics of it? Does it have a feeling to it? Does it have a color? Some people kind of feel in different, modalities where it might be like, oh yeah, it's red. It's, it's this. Does it have edges? And what happens when we bring that, to that craving itself? So we can start to do two things with this. One is we can start to see that cravings aren't as scary as our minds make them out to be, because we're typically running away from them, or we're satisfying them as quickly as possible because it's uncomfortable. So we can learn a type of distress tolerance, like, oh, here's some distress. Maybe it's not as bad as I thought. And two, we can start to really foster and develop curiosity. Each time we go, oh, we're awakening it. We're starting to train ourselves to bring curiosity to that situation. So whenever there's an, oh no, I have a craving, we can start to awaken that, oh, what does this feel like? Where is it in my body? And so on.